Good evening, everybody, and welcome to another edition of the South Florida Tribune podcast. And as usual, we also feature my co-host Gary Kornbluh. Tonight's show, we'll talk about Cobra versus a marketplace or Medicare. And Gary, before we go into any details about this show, why don't you give everybody an overview about what we're going to talk about?
Well, we're going to talk about just that. Many people are qualified for Cobra coverage for different reasons, and you want to make sure that you're making the right selection between either Cobra you're being offered, and then compare that to either Marketplace if you're under 65, or a Medicare product if you qualify for Medicare if you're over 65 and qualify for Medicare.
So, folks, my best advice to you is please get a pencil and paper or pen and paper. There's a lot of information to digest in this broadcast, and we're hoping we can give you the best information so you can make a very intelligent choice when indeed you decide to do this. Before we go into the broadcast, just to let you know if you're listening to it audio, you can do so on Spreaker, Spotify, Apple, Google, iHeart, or wherever you get your podcasts. If you're looking for the visual side of this show, you can go to our South Florida Tribune YouTube channel and go ahead and please subscribe, and you'll be able to see us that way as well. And of course, if that isn't good enough, go to www.southfloridatribune.com and you'll be able to locate it there. So this is the simulcast, and of course, Gary Kornbluh has been with us for quite a period of time, and we want to make sure that we educate you the best way possible. So now, without any further delay, Gary, what is Cobra and how is it different from the coverages compared to my current group policy?
Okay, so what is Cobra and how does it differ from your group policy? It's actually the same policy. So Cobra is actually a law that was passed in 85, and it's Cobra is just an acronym that stands for Consolidated Omnibus Budget Reconciliation Act of 1985. So really very simply, it's just an act that allowed people to continue with their coverage if they lost their group coverage, whether through retirement or, of course, if they're eligible for Medicare, well, that's another subject that we'll get into. But Cobra is kind of a continuation of coverage, is basically what it is. And it's the same policy really as the coverages that you have enjoyed as a group policy through your employer. The only difference really is that keep in mind that employers usually subsidize at least 50% of your premium. So the difference is, and the reason why Cobra is usually kind of an expensive option, is because once you take that Cobra, that continuation of coverage, there's no more company subsidy. So you're actually forced to pay full price. The most common continuation of benefit period is 18 months. And again, you're forced to pay full price when you go with Cobra, because once again, that subsidy is gone once you're separated from service. So there are other viable options, um, such as the marketplace. But we'll get more into marketplace coverage versus and Medicare coverage versus Cobra.
So, really, what you're telling me that you must pay full price, and that's why ACA is a great option.
Absolutely, yeah. Once you're offered Cobra, unfortunately, that subsidy that the company has been paying, and again, it's usually half. It disappears, so it makes that insurance very costly. It's nice when you're working for the company because they help cover the costs of your premium, and it's taken right out of your pay. So it's kind of painless. You don't really feel it so much. But boy, when you come off that for that same exact coverage, and you lose that subsidy, yes, it can be very, very costly.
So for a lot of folks that are watching and listening to this, we just want to clarify a specific point. And I emphasize clarify a specific point. That in most cases your coverage is the same, but it does not include the subsidy from the company.
Correct. That's exactly right, Scott. And that is precisely why the marketplace can actually be a really good option, because you can pick back up a subsidy from the government, right, to help you pay for that insurance. So you may have lost the subsidy from your employer, but you'll be able to pick up, hopefully, not in every case. It's based on your annual household income, but an agent, whoever you're working with, will determine what, if any, tax credit you qualify for, and that can certainly really help reduce your monthly costs. So um,
So really the point is what you're saying, it's temporary coverage until you land on your feet and you want to get it off it as soon as possible.
yeah, that's a good point, Scott, because it actually is temporary. I mean, it's in the best case scenario, it's only extended for 18 months. And
Right.
then and a lot and I wouldn't say a lot of people, I would say my experience has been that maybe 20 to 25% of the people actually stay on their Cobra plan. Most of the people, go leave Cobra because it is very costly. And then again, the marketplace is always a good option. Now, there's also other options too. There's short-term medical, and we can get into that too. And also, you can go on to www.southfloridatribune.com and look up my podcast. And I actually did a separate podcast, and when we talked about short-term medical, remember, Scott?
Well,
So
yeah.
the viewers and listeners can always revert back to that that podcast about short-term medical if they really want to understand, if short-term medical is a good option for them. The best way to understand the option that's going to serve you best really is to talk to somebody like myself. Hopefully, you have an agent that's knowledgeable like myself, and they can give you that guidance that you need to help you make the best choice.
You make a great point, Gary. All your shows are definitely on southfloridatribune.com as well as South Florida Tribune YouTube channel. So, you have a lot of great stuff. And I know that as we continue to move forward with the relationship, I can only imagine how many great shows that we have planned ahead. So, yeah, folks, don't be afraid to go to South Florida Tribune podcast on the website, www.southfloridatribune.com. You're going to see some dynamite stuff with Gary's shows. And more importantly, he writes for us as well. So if you are looking for more detail on what Gary's work is all about, then don't hesitate to go to his content on contributors writing. Great stuff, Gary. So, all right. So am I better off taking Cobra or am I better off taking health insurance coverage through the marketplace?
So that's the $60,000 question. Am I better off taking Cobra or better off taking health insurance through the marketplace? Now that's assuming you qualify for marketplace coverage. In other words, that's assuming that you're not Medicare eligible. You're Medicare eligible once you turn 65, and then also some people that are disabled are also Medicare eligible. So you're actually, in most cases, I've observed that people are better off taking the health insurance through the marketplace because of the subsidies. Now, it's a simple calculation. It's really just a simple cost benefit analysis, really. I mean, how much are you paying for the Cobra? And what kind of coverage are you getting? Versus how much you would pay through the marketplace, with or without a subsidy, that would give you similar coverage that you enjoyed through your group plan, which would then become a Cobra plan. So really, again, it's a very simple cost benefit analysis. What am I paying? What am I getting for that money I'm paying? Versus what would I pay through the marketplace, and what kind of coverage can I expect to receive? I would say 8 times out of 10, almost 9 times out of 10, folks are opting for the marketplace and not Cobra, because Cobra, again, tends to be the expensive option, and it's typically not worth it.
No, that's a good point because I know you discussed here that you simply look at the cost versus Cobra versus the cost versus ACA coverage, and I think you pretty well illustrate your point really well. It's all about comparing and contrasting what makes sense for your budget, but more importantly, though, it's all important to make sure your benefits are satisfactory because if you don't have good benefits, depending on what your cost analysis amounts to, it doesn't matter because you're going to go upside down one way or the other. So that's why you have to have a good enough agent to make sure you're able to point out A versus B, and then you make sure whatever one you have makes the most sense in more ways than one. So good stuff. So Gary, with that said, once I turn 65, am I better off staying on my group plan or am I better off taking Medicare?
Okay, and that's a decision that many folks that are retiring have to make. And of course, once they're 65, now keep this in mind. Once you turn 65, you actually very few companies offer Medicare benefits. So what I was going to say is once you turn 65, typically you're actually going to go on Medicare. Now, having said that, you can stay on your group plan as long as you want. Look, I can stay on if I was in a group plan, I have an individual plan for myself because I'm self-employed. But if I was part of a group and let's say I turned 65, it doesn't matter. I don't have to take Medicare at that point. I'll be issued a Medicare card with just Part A, hospitalization. But I can delay my Part B as long as I want. I can delay it till I'm 80 years old. Let's say I delay my Part B. I'm going to stay on my group. I'm going to continue working for that company until I'm 80. I can actually delay my Part B, delay enrolling in my Part B for as long as I want, as long as I've got creditable medical and drug coverage. Okay. But again, it comes down to the cost benefit analysis, similar to the last question. Should I take Cobra or a marketplace plan? Again, you've got to just do the math. What am I getting in my group plan versus what a Medicare plan would offer me? And I would say more like 9 times out of 10, almost 10 times out of 10, folks are opting for the Medicare versus staying on their group plan. Now, it's usually, and it seems that a lot of people are retiring. A lot of people are being kind of forced into retirement during this post-COVID period. But there are some really great options with Medicare. And again, I go back to some of the prior podcasts we've done. We've done podcasts about Medicare supplement policies versus Medicare Advantage. So you do have a lot of choices, okay? And it's one thing if your company is, offering you full retirement benefits and they're covering the cost. They're paying for your benefits. You essentially have a zero cost. That's one thing. Obviously, it would be wise to stay on that plan for obvious reasons, right? There's no cost. But in most cases, if most folks don't really get full retiree benefits, so they're forced to pretty much go on to Medicare. Now that's not a bad thing because there are some really, really good Medicare options. Again, and I mentioned this on a prior podcast, a Medicare beneficiary's best option is obviously original Medicare and a supplement because it gives you access to the entire Medicare system nationwide. Whereas a Medicare Advantage plan can be a good option, but you're confined to the carrier's network. Even if whether it's an HMO or a PPO, you're still confined to that carrier's network. You have to stay, you can only go to doctors, specialists, hospitals within that particular insurance company's network. So in that case, original Medicare and a supplement's usually a better choice if it's affordable. And that's a big factor too.
Yeah, I think the one thing that I want to make sure that we transfer to our audience here is it really, like you point out, it all comes down to cost and benefits. And any smart consumer would realize that you just have to utilize your advantage to the best you can and drill down and do the analysis so that that agent is qualified to point out is what's best for you. I mean, I know that these points are very redundant, but they're redundant for a reason because you're trying to make sure the repetition is enough to keep it simple, stupid. And cost and benefits factor into anything that you do, whether it's health insurance or whatever, auto insurance, whatever the case may be. I don't care if you're getting an air conditioner, cost and benefits. Is it cost you more money to repair what you had before, or do you get a brand new one? So this concept is very universal all the way, especially when you're dealing, like I say, with what we're doing, talking about here, and that's health insurance. So I love the way you're able to keep it simple and point out what's necessary. But don't, folks, make sure you have a really, really good agent. A good agent will spend the necessary time that you have to do. And I think the one thing what I've enjoyed doing with Gary on these broadcasts to me is making sure you have a guy that knows his stuff. He's been in the business for 32 years. So you have a guy that's been around a long time that will take the necessary time to do what they've got to do. So as we move on here, so if I decide to take Medicare Marketplace coverage, whichever program I qualify for, can I keep my dental and vision plan?
In certain circumstances, you actually can. That's actually a great question because, and many clients ask me that. They're let's say they take a Medicare supplement plan and a standalone Part D Medicare Part D drug plan, because if you, as you know, if you take a supplement to supplement your original Medicare, you need a Part D plan, a prescription drug plan. So in that case, it would be wise to ask your HR department if you can continue with the group dental and group vision. And many companies will allow you to do that. So don't forget to ask your HR department. Let's say you're eligible for Medicare and they're going to terminate your group medical plan. That's fine. That needs to be done because you're going to qualify for Medicare and you're going to be covered by Medicare. But again, make sure you ask that very important questions, to your HR department. Can I keep, I know you're canceling my medical plan because I'm going on Medicare, but can I keep my group dental and my group vision plan? And of course, they'll bill you separately for it, so you'll have to pay for it. But in most cases, the group dental and group vision plans offer much more robust coverage than what you can get in the individual market. So again, if they'll allow you to continue that group dental and vision, absolutely continue the group dental and vision. I even have people that take Medicare Advantage and even they continue with their group dental and vision because the dental and vision that's offered through Medicare Advantage policies are good, but they're not, the coverage is not great. So it's kind of basic dental, basic vision coverage. Usually you've got, again, more robust benefits through your group dental and vision. So in most cases, if they'll allow you to continue with the group dental and vision, absolutely, my recommendation would be absolutely take it. It's excellent coverage. You don't want to lose it. Plus, you may have met your deductible already, and just again, continue with that plan if that employer allows you to do so. If they don't, that's fine too. I mean, an agent can find you individual dental and individual vision coverage as well. So there's still an option there, even if you can't continue on that group plan.
So really what you're basically saying is in many cases you may be able to continue with the dental and vision.
Right, through the group, right. Even though they're canceling your medical, in many cases, I would say about half the cases that I've been involved in, the companies, it's usually the larger companies, but yeah, they'll usually let you continue with the group dental and vision. And it is absolutely worth paying for. Because if you compare it to individual dental and vision, it's definitely better coverage.
Okay. And finally, what if I am eligible for Medicare, but my wife is not 65 yet? How can I know which is the best option?
That's a really common scenario, really, because men are typically what, a couple of years older than their wives. I mean, I think that um, has proved itself out. So there's that gap. Husband's turning 65 now; he's eligible for Medicare, and let's say the wife's only 62. Um, so it depends on who is the primary um, applicant. So let's say if the husband's the primary applicant, well, that's an easy choice. Unless they're able to offer continuation coverage for the spouse, the 62-year-old spouse, and in some cases that can be the case as well, where they can extend the group medical coverage as well to that spouse that hasn't turned 65 yet. It's usually, though, it's the husband would typically could be continue he would have to continue working for the company. He's just taking Medicare now because now he qualifies for Medicare, and he understands that he can get better coverage through his Medicare. But now, what if the wife is the primary owner of the policy, right? And she's 62, and her 65-year-old husband is also covered under her policy. So that's easy. She can just call her HR department, human resources, and then just have them delete him or cancel him off the plan. And you can do that anytime you're eligible for Medicare. So let's say his birthday is April 15th, right? That's a great day, right? Tax day.
Mhm.
So his Medicare Part A and B would take effect on April the 1st. So she would just have to make sure that her company covered him up until the end of March, so that there would be a continuation there. There would be no lapse in coverage. He would go right from the group plan right to Medicare. So again, it all depends on who is the primary on the group plan. But again, a good agent will be able to help you decide which option is going to be the most cost effective. So again, it's all about having a good agent, um, crunching the numbers with your agent, and doing that very important cost benefit analysis. It seems simple and obvious, but you would be surprised that how many people ask me, what's my best option. Well, let's look at what you're paying. Let's look at the coverage you're getting. Okay, here's option B. What are you paying, and what coverage are you getting? So it's a pretty simple analysis, or so it would seem, but there's just so many moving parts to health and Medicare that you're always going to be better off. Don't go this alone. I mean, it's a daunting task to try to figure this stuff out on your own. You'll just get frustrated, and well, you probably end up calling an agent anyway. So do yourself a favor, just contact your agent right off the bat, and give that agent the opportunity to help you, to help you to make a smooth transition. Once the younger spouse turns 65, again, that's easy. They just come off that group plan, and now they qualify for Medicare as well.
All right. So Gary, I have a question that just entered my mind. Okay. You've been in the business a long time. Do you ever see anybody that retires at the age of 62 ever being eligible for Medicare, or will it always be at 65?
It's under normal circumstances, you must be 65 to qualify to age into Medicare. Now, there are certain situations where there are people that do have Medicare and they're not quite 65. So it's very easy for a 62-year-old to have Medicare. It's usually because they're disabled. Because if you're disabled for a period of 24 months, um, the government will automatically issue you Medicare Part A and Part B. So if you're working for a company, um, you're you would be wise to just stay with your Medicare plan
All
if
right.
that's the case.
But aside from that, I'm just really curious, okay? Let's face it, okay? I'm fortunate that I get my health insurance for my wife, thankfully, but there are some people that aren't as fortunate. And that question comes into play where do you ever foresee a time where they will ever lower the Medicare age from 65 to 62?
They were actually talking, Scott, about lowering. It was part of the whole, I guess, the whole package from our current administration. It hasn't been passed, but it was Medicare. There was a piece on Medicare, and they actually were talking about lowering the age to 60. Actually, um, I think that's a great idea. Now, I'm not an economist, so I'm not sure what the economic implications would be. But it would seem to make sense to me to open up another group, a 5-year group of people from age 60 to 65. Those people, unfortunately, are in the group uh, where they have to pay the highest medical premiums. I mean, in some cases, I've seen premiums for an individual that's between 60 and 65. It's not uncommon for them to pay seven, eight, 900, maybe $1,000 a month um, for health insurance. So I think it would be tremendous if they would roll back the age to 60. That would actually mean that I would qualify. But other
Well,
than that, I mean, I think it would be. I think it would be tremendous. Not sure. At some point they might do it, but I think we're probably going to stay at 65 for the foreseeable future.
I'll be turning 60 at the end of the year, but thankfully I'm fortunate to have my own policy through my wife and their exceptional benefits. So, Gary, great job tonight. Really, you have a lot of great stuff. For a lot of you folks out there, if you haven't gotten a pen and paper, please get one. There's a lot of great information. I think we've covered this subject very thoroughly, going from Cobra to the marketplace to Medicare, and then we've even taken Medicare to a different level. So, Gary, all right, well, we have another minute or so. Why don't you let everybody know they can get a hold of you, and then I'll go over our contact information as well.
Absolutely. Thanks, Scott. You can reach me. You can always reach me on my cell phone, which is 561-305-5949. My phone's on 24/7, and your agent should be available 24/7 as well, um, especially during a pandemic. You can also reach me at my office, 954-532-2060. You can go on my website, www.medigapx.com. That's MEDIGAPX.com. You could click on my testimonials tab and see what some of the comments that were left from my wonderful customers. And I'm proud to say that I've got 80 Google 5-star Google reviews. And I'll tell you, whether you're looking to buy a car or an exercise bike or a health insurance or Medicare policy, always, always, always go on Google and check the reviews. That'll give you a very good indication of who you're dealing with. Um, after you read those reviews. So
Well,
that's how to get a hold of me, and feel free. Again, I'm available 24/7.
Well, Google's worked out handsomely for you. All right. So just so you know, folks, this broadcast is being simulcast. And if you want to hear the audio version, do so on Spreaker, Spotify, Apple, Google, iHeartRadio, wherever you get your podcast. Once again, subscribe to the South Florida Tribune YouTube channel for free. Okay, our website is www.southfloridatribune.com, and you can find us on Twitter at Tribune South. And if that isn't enough, feel free to email us at southfloridatribune@gmail.com, and then we'll be able to answer any questions that you may have. So, on behalf of Gary Kornbluh, my name is Scott Morganroth. Thanking you for joining us on this edition of the South Florida Tribune podcast, and we look forward to Gary's next show. We will announce that. So, once again, Gary, phenomenal job, and look forward to doing it again. So, take care, everybody, and thank you very much for joining us. Good night now.
Good night, everybody.